Hello friends, welcome to my channel. My name is Karis. In this series, we will talk about anatomy of musculoskeletal and nervous system, and today is the first video of the series, and we will talk about the basis of the anatomy before dive deeper into the other skeletal and musculoskeletal and nervous system anatomy. So today we'll talk about the planes and some medical terminology to describe the movement and also the placement of different parts of the body. So we have three planes of the body. We have transverse plane, which divide the body into the upper and lower part, also call it horizontal plane, and we have a frontal plane, which by its name it divides the body into the front part and backward, or anterior and posterior. And third one, we have a sagittal plane, which divide the body into the right and left part. So we have these three planes, which mostly we use in radiological examination. Now let's talk about the medical terminology that use it to describe the movement of the body. So we have abduction and adduction. Abduction, which use it when the part of the body move away from the midline. The midline is the source. When the parts of the body move away from the midline, call it abduction. Now it is abduction or abduction, and it is adduction, which means adduction is when the part of the body move closer to the midline. It is adduction also. The part of the body close to midline. Abduction and adduction. We have also flexion and extension. Flexion mean when the joint angle is decreased. What's the joint if you don't know? The joint is the placement when the two bones come together, they make a joint. When there's two bones, they form a joint. This joint has an angle like every other joint. The joint, when the angle of a joint decrease, we call it flexion, while the increasing in the angle is called extension. Flexion, decrease the angle, extension, increasing the angle. So it's also can be applied of all parts of the body. We have lateral rotation or external rotation and medial rotation or internal rotation. It is the rotation of a joint. External rotation when the joint move outward, and internal when the joint move inward. We have the other thing, which is circumduction, which is circular motion of a joint. We have these three to describe the movement of the body, and if I forget anything, let me down in the comments below. So now we will talk about the medical terminology that use it to describe the placement of a bone or a muscle. Now, before we talk about the medical terminology to describe the placement of the parts of the body, we will talk about anatomical position, which is very easy yet very important thing to know, which is the body in upright position and the head in upright and the hand like this, which is the palm facing forward. We need to know this because when we describe the placement of a bone or a muscle, we will use the anatomical position. So the first terminology that we have is dorsum and ventral. Ventral means anterior and dorsum means posterior. For example, in anatomical position, the hand is like this. This part become ventral, and this is dorsum. But we have an exception, which is in the feet. The upper part of the feet is dorsum and the lower part is plantar. We have just this exception, and the others all the same. And we have a terminology that used to know the closeness of the part of the body to the midline. So we have a proximal and distal, which is used to know the closeness of the part of the body to the midline of the body. For example, we say ulna, which is this one, and we have radius. Ulna is proximal to radius. The source now here is midline of the body. When we say ulna is proximal to radius, mean ulna is closer to the body than radius. And we have distal, that we can say the radius is distal to the ulna, which means the distal the radius bone, is more distal than the ulna, comparing to ulna, which means radius is more far from the midline of the body than ulna. And we can also describe other parts of the body like that, but this is just for explanation. And we have the other thing that's close to that, but it is to superior and inferior, not to the midline, which is caudal and cranial. Cranial, which we mean the head. When we say, for example, upper limb is more cranial than lower limb, which means the upper body is more upward than lower body. Or caudal, which is come from the foot, it means inferior. We can say lower body is more caudal than upper body, which means lower body is closer to the feet or inferior to the upper body. And I think that's it for today, and if I forgot anything, let me down in the comments below. And if you find this video beneficial, don't forget to like, subscribe and share it with your friends. Thank you for watching, and see you in the next video.